What are the two main concerns with dentistry in general, whether we're doing general dentistry or whether we're doing cosmetics or implant treatment? I think there are two. One is the treatment going to be painful? And secondly, how much is that treatment going to cost? When it comes to pain, there are several options we have for pain management. We all know about local, and local means that we give an injection, the area goes to sleep, patient's still awake of course, and we can do our routine dentistry, whether it's taking out a tooth or putting a crown on the tooth or doing a filling, that would be routine dentistry. We also have patients that are very nervous, so no matter what we're doing in dentistry, whether it's a clean or an exam or it's a simple filling, they would still like to have something to actually take them away from reality. Okay, one of the most easiest things to do is what we call penthrox, and we sometimes call it the green whistle, and basically it's an inhalation. You actually breathe it in, and what it does is take the edge off. They use it a lot at the Royal Life Saving and St John Ambulance, and what that is just taking the edge off treatment, and it could be just the injection. Patients could be very nervous about getting the injection, so we can give them that just to calm them down during that process. They have the injection, everything's numb, and they're fine to go ahead with treatment. We also have tablets that patients can take that will also relax them. And lastly, it's also sedation. We can actually put a patient to sleep. The safest way to do that is by using an on-site anaesthetist, which we have here in the building, and the anaesthetist can actually administer drugs in order to put the patient to sleep. Okay. The role of the anaesthetist is to really keep the patient safe and comfortable throughout treatment, and generally we use their services when the visits are going to be very long or if the patient is very nervous about getting treatment. The cost of getting treatment. I want you to remember that all dentistry is optional. So when it comes to actually working out how much treatment is going to cost, you have to remember that there are always options. I sometimes give the example of a missing front tooth. If you're missing a front tooth, there are actually 4 options for a patient with a missing front tooth. They could actually do nothing. It's not a life-threatening condition not to have a front tooth. So a patient may decide that they're fine to walk around not having a front tooth. So of course that option costs nothing. Secondly, they may decide to have a denture, just a partial denture that has 1 tooth on. A partial denture could be anywhere from say $500 to maybe a few $1,000s to get a partial denture made. They may decide no, that they don't want something that they need to take in and out of their mouth. They may decide to have a porcelain bridge, or they may decide to have a new tooth paste or a dental implant, and that could be $5,000 to $6,000. So for this patient that has 1 single missing teeth, there are actually 4 options for that patient. What I want you to remember is that because dentistry is optional, it's up to the patient to decide on what option best suits them. There is no right or wrong option. The most important thing is to know what your options are and then choose the best option that suits you.